This video will teach you how to complete a comprehensive intake in one chart. By following these simple steps, you will learn how to room your patient after they have checked in for their appointment. Please note that this is an overview only and is not department specific. Check with your office to learn what information is needed for their office. From the Ambulatory Summary view, you can click on the drop-down arrow on the Vital Signs tab and select the Comprehensive Intake option. A new window will open with various tabs listed on the left and a documentation window on the right. We will briefly cover what each tab contains, but please note that the tabs that you will complete will be specific to your department, location, and provider. The summary page is where you can enter in the patient's chief complaint, whether they have any advance directives, and if applicable, their menstrual status. You can also enter in the patient's height and weight, which in the ambulatory setting is typically measured in pounds and inches, although the options for kilograms and centimeters are also given. You should, however, only enter in one height and weight measurement when charting. The BMI and BSA are automatically calculated for you after the patient's height and weights are entered. Vital signs are also entered on this page, including a basic pain assessment. To meet the requirements for meaningful use, a height, weight, and blood pressure need to be documented on every encounter. The patient's communication preference can be charted here and carries over from visit to visit. If you enter in or change the communication preference, you must select the Submit button to accept the changes. The next tab is Health Status, where you can chart if the patient's immunizations are up to date and if the patient has had any medical encounters, such as a hospitalization, since their last appointment. In the Demographics tab, you can enter in the patient's preferred name and if they have a religious preference. Note that any fields that are marked with an asterisk will retain the charted information from visit to visit. The contact information for the patient can also be viewed from this page, but may not be the most current information. It is best to view the contact information from the registration page. The Other Contact section is a helpful place to view the individuals the patient has authorized their information to be released to. In the section labeled Care Providers, you can enter in any providers that are involved in the patient's care. You can also list their specialty and the reason why they are seeing the patient. In the Ancillary Service Provider section, you can enter in information such as the patient's preferred DME provider that supplies their oxygen and respiratory care needs. If the patient has any medical devices, you can simply click on the box to the left of the device. If you do not see the device listed, you can select Other, which will open another free text window where you can enter in the name of the medical device. If the patient does have any durable medical equipment, you can also check the box to the left. If your option is not listed, you can click on the Other option to open up the free text field. The Problems and Visit Diagnosis section is not typically completed by the office staff. Most often, this section is completed by the healthcare provider. However, it is important to be familiar with this tab. The top window will list the problems and diagnoses being addressed at this particular visit. In the Problems window below, you will often see chronic medical conditions and historical data for the patient. It is important to check with your office to see how they would like you to use this tab. The next section is for the patient's medications and allergies. In the window at the top, the allergies for the patient are listed. It is important to verify all allergies with the patient at each encounter. If the patient has no known allergies or no known medication allergies, simply check the appropriate button. To add an allergy, simply select the Add button, which will open up a new window. You must complete all required fields, which are highlighted in yellow. You can type the desired medication in the substance field. Selecting the Binoculars button to the right will open up a new window where you can choose the name of the substance desired. For our example, we will add Darvon to to the patient's drug allergies. It is best practice to enter in as much information about the allergy as possible, such as noting the patient's allergic reaction. Our patient has a history of hives and anaphylaxis after taking Darvon. Note that when you move your cursor to the Reactions field, a new folder option is listed below where you can choose from the Common Allergy Reactions folder. To make your selection, simply double-click on the reaction or reactions listed. Afterwards, you can select either OK to close the window or OK and Add New to continue adding more allergies. Note that you would follow the same process for adding environmental or food allergies and documenting their reactions. If the allergies in the patient's chart are correct, right-clicking on the item will give you the opportunity to select Mark as Reviewed. If all of the allergies listed are correct, you may also select the Mark All as Reviewed button to update them all at once. If the allergy needs to be modified in any way, you can select the Modify button available at the top of the window after highlighting the substance. You may also modify an allergy by right-clicking on the item, which will give you the opportunity to select Modify. This will open a new window where you can make the appropriate modifications. The next section to complete is the patient's medications. From this list, you can review the medications the patient is currently taking. If you need to add a medication to the patient's list, selecting Document Medication by History will open up a new window. If the patient is not currently taking any medications, you can select the No Known Home Medications listed at the top of the window. Selecting the Add button will allow you to search for the desired medication. You can either enter in the name of the medication in the search field or open up the appropriate folder of common medications. You can select a medication from the list options, which will change the color of the text from black to blue. You can select more than one medication from the list if applicable to your patient. After adding the names of the patient's medication in the search field, clicking Done will close the window. The new window will allow you to enter in the details of the medications the patient is on, such as the medication's dose, route, and frequency. An important step in charting the patient's medication list is to document their medication compliance. You can accomplish this by selecting the Compliance tab in the Medication Details window and selecting the appropriate details from the drop-down menus. After you've completed charting your patient's medications, selecting the Document History button at the bottom will close out the window. Once your medication history is completed, you should see a green check mark next to Meds History in the status bar. If you do not see a green check mark, additional documentation is needed. This will prevent an error from occurring for the physician later in the appointment when they are completing their patient medication reconciliation. The Review of Systems and Pain tab is not often used in the office setting. However, there may be providers that will request to have some of the review of systems completed by staff. Please note that there is a more detailed pain assessment available in this tab that may also be used in addition to the broad pain assessment covered in the Summary tab. There is also various pediatric pain scales available below that may be utilized as well. The Procedure and Surgical History tab is next. If the patient already has their past surgeries documented, you will need to review them to make sure that they are documented correctly. If no changes are needed, selecting Mark All as Reviewed will verify the surgical history is up to date. Selecting the Add button will open a new window for you to add any procedures or surgeries that the patient has had. Choosing the binoculars after typing all or part of the name of the procedure will open up a new window giving you a list of procedures to choose from. Note: It is important to verify that your terminology filter is set to all terminologies prior to choosing a procedure from the list. If you have anything else in the terminology field, selecting the ellipses button on the right of the field will open a new window, allowing you to change the terminology to all. Selecting OK will close the window. Selecting the procedure that has the SNOMED code listed is recommended due to the conversion to the ICD-10 code set. Selecting OK will close the window. Continue completing the procedure history information by entering in either the date of the procedure or the age of the patient at the time of the procedure. If the patient is unsure of the information, the system allows for the entry of fuzzy dates by selecting the age or date term listed in the blue text. This will allow you to enter the approximate age of the patient, such as around the age of 32 or around 2002. There are also fields you can complete to document the location of the procedure if appropriate. Once you have completed entering in the procedure information, you may either select OK to close the window, or if the patient has any more procedures to enter, you may select OK and add new. To make finding and entering in procedures more quickly, you may also choose the Folders button in the window below, selecting the Procedures folder to open additional folders that will list the most common procedures for a specific specialty. Only the procedures with SNOMED codes are provided in these pre-made folders. Selecting OK will close the window. In the Family History tab, you can review any information currently listed. If the information is correct, selecting Mark All as Reviewed will complete this section of the intake form. You also have the options of selecting Negative, Unable to Obtain, or Patient Adopted if applicable to your patient. Selecting the Add button will open up a new screen allowing you to document the patient's family history. The most common family members are already listed at the top. If you need to add additional family members, such as a brother, selecting the Add Family Member button will give you a list of more family members to choose from. Please note that you can no longer chart a generic family history of condition. You will need to link a condition with the particular family member affected. Clicking once on the relationship type will open a new window where you can add more detailed information about the family member, such as their name, if they are deceased, their age at the time of death, and their cause of death. Selecting OK will close this window. If the patient does not know the health history of a particular family member, or if there is a negative history, you may also chart this by selecting the appropriate option from the drop-down list. In the far left column, there is a list of common medical conditions categorized by body system. If you cannot find the condition you need, clicking on the magnifying glass for the appropriate body system will open up a new window. Be sure that your terminology field is set to all terminologies before typing all or part of the name of the condition you are looking for in the search field. A list of options will be generated. Double-clicking on the name of the appropriate condition will move it to the bottom of the window. Selecting OK will close the window. To add the family history for a particular condition, you will click once in the gray box below the appropriate family member, which will place a plus sign in the field. If the patient has any additional details about the family member's condition, you may double-click on the gray box to provide the information, such as age of onset and severity. Selecting OK will return you to the previous screen. If all the family members listed have a negative family history for the same condition, selecting the negative sign after the condition will place a negative history for everyone. However, if you know that only specific family members are negative for a condition, you may click once in the white box to document a negative history. Selecting OK will close the window. In the Social History tab, selecting either the Add button at the top or double-clicking on the appropriate category will open up a new window. To meet the current requirements for meaningful use, all patients over the age of 13 must have their smoking status documented and reviewed at every appointment. Selecting the appropriate status option from the drop-down menu fulfills this requirement. Selecting OK after charting any additional details provided by the patient will return you to the previous screen. The OBGYN history is only to be filled out by specific offices and should not be documented in unless specified by your provider's office. The Birth History tab is also only to be completed for specific patient populations and should not be documented in unless specified by your provider's office, such as for pediatrics. If the child was born at a Via Christi hospital, the information will auto-populate from their delivery visit. Patients born at an outside facility may need to have their birth history documented. Currently, no documentation is to be done in the Education Needs section. The More Measurements tab is typically completed by offices that deal with weight management. The More Vitals tab is frequently used to help staff document additional vitals on the patient from a specific visit, such as serial blood pressures, orthostatic vitals, or more in-depth respiratory measurements. The Fall Risk, Domestic Violence, and Depression Screening tabs are all typically completed for the elderly patient population during their Medicare visits, but may be used on other patient populations depending on the patient documentation needs. The Infectious Disease tab is a newer tab developed after the Ebola spread. Currently, this tab is to be filled out when a patient has traveled to areas considered at high risk for Ebola transmission. Although the specific tabs that you will complete on your patients will be dependent on the office you are working in, there are 3 tabs that must be documented in at each encounter. The tabs that have required meaningful use documentation that needs to be completed at every office visit are located in the Summary, Meds and Allergies, and Social History sections of this form. Once you have completed all of your documentation, selecting the green check mark at the top left-hand corner will sign your form. This concludes the video on how to complete a comprehensive intake form in one chart.